आज हम बात करेंगे एक ऐसे ग्लैंड के बारे में जो छोटा सा तो है लेकिन हमारे बॉडी के सारे फंक्शन में एक मेजर रोल प्ले करता है। प्रॉब्लम तब होती है जब ये ग्लैंड या तो बहुत ज्यादा एक्टिव हो जाए या फिर स्लो हो जाए, जिसे हम कहते हैं हाइपरथायरॉयडिज्म या हाइपोथायरॉयडिज्म। तो आज के एपिसोड से हम ये समझते हैं कि व्हाट आर द थायराइड डिसऑर्डर्स, इनके साइंस एंड सिम्टम्स क्या होते हैं और इसे मैनेज कैसे किया जाता है। नमस्ते एंड वेलकम एवरीवन टू अनदर एपिसोड ऑफ बियॉन्ड द पिल वेयर हेल्थ मीट्स कन्वर्सेशन। आई एम योर होस्ट डॉक्टर चेतना and in today's episode, we will dive deep into the topic of thyroid disorders and its management. To make us understand this better, joining us today is Dr. Supratik Bhattacharya, a leading and reputed endocrinologist and diabetologist practicing in Kolkata, addressing hormonal imbalance, managing adrenal gland disorders, treating PCOS. So let's give him a warm welcome and understand today that what exactly is thyroid and how we can manage it efficiently. So hello, doctor, and thank you for coming to our show, which is Beyond the Pill. And firstly, thanks a lot for your precious time. I know that you're a busy person, and also I would just want to give you a compliment. Like, you're a very handsome personality sitting there. So thanks a lot for this. And then, how do you feel about it?
Right. So thank you so much for this kind invitation and for your kind remarks. Really appreciate. And I think what you have come out with is a very good initiative. We should reach out to everyone and they should be aware about things that we don't get an opportunity to speak at length during our usual conversations
Correct.
that we have at the clinic. Yeah.
So just before getting into like our topic, which is thyroid, I am really keen on knowing like how was your journey as a doctor? What made you decide to get into endocrinology or become a diabetologist?
तो वैसे देखा जाए तो I was very good with physics and maths. But so there came a time when I had to decide what I needed to be. And, so my grandfather, he was a doctor and my dad was an engineer. So
Okay, both the
my
genes.
grandfather said, don't be a doctor. And my father said, don't be an engineer. So I had to take a call basically. And I felt that, if I did not study medicine and I pursued, physics or maths for that matter, so I would be missing out on something.
You were feeling that way, okay.
Yeah, so that's what I did because that's where my heart lies, and I'm absolutely, I feel that decision was perfect because I'm
You enjoy
very
what
happy
you do.
with the decision that I had taken at that time.
So why an endocrinologist?
So endocrinology में क्या होता है, बहुत सारे numbers होते हैं and I'm good with numbers, like, and the good thing is आप सामने देख सकते हो.
Okay.
So अगर आपका शुगर बढ़ा हुआ है, you do an intervention, आपको दिखेगा कि आपका शुगर नीचे आ रहा है and it is visible to the patient also and they feel good looking at the numbers.
Okay.
Similarly, with any other endocrine problems, it's more of the numbers and it's actually something that you can document and it's right on the face.
So you see the
Beyond the
results.
fact that, you are making the person feel better as well. And obviously, मैं तो काफी बारी ये बोलता हूँ कि we are treating the patient as a whole, not just the numbers.
Understood, yeah.
So the patient's quality of life is what is more important to me. And if they feel better, that's what makes me most happy about.
So this is a field which gives the results, and that is why you feel like this is like a satisfactory field out of all the fields. Okay. So why I asked this question was because many of our people doesn't know what is endocrinology, because the thyroid disorder or diabetes, if you say, they know that they should go to a GP, but then they don't know that there's a specialization in this field as well.
अभी तो काफी जानकारी है लोगों में, and then they would actually find you. So, they'd look for doctors and then they would come and find you basically. But मेरे ख्याल से, it's very important to talk about science at various platforms. And हमारा concern ये रहता है कि whilst it's a boon कि बहुत सारे social media है अभी जिसके through बहुत सारे जानकारी हमको मिल रहा है, but many of them are pseudosciences.
Okay, yes, right,
and so the listeners are sometimes confused as to what to believe and what not to believe.
Yes, that is true.
जैसे काफी बारी ये बोला जाता है कि ये लेने से आपको जैसे इंसुलिन नहीं लेना पड़ेगा, एंड दैट बिकम्स detrimental for those who are living with type 1 diabetes,
Yes,
for whom
yes,
insulin is life, you
yes.
know.
हाँ, and अभी तो ऐसा है कि social media में there are like lot of myths and misconceptions going about all these thyroid, diabetes, because I feel ये जो ऐसी topics है, these are like very lifestyle related disorders firstly, and अभी every second house has this thyroid and diabetes. So ज़्यादातर आप कौन से patients देखते हो? Like
तो ही मैं बोल रहा हूँ कि आप कैसे भी कुछ भी प्रैक्टिस करो, इवन आप मेडिसिन भी प्रैक्टिस करते हो, तो ज्यादातर लोग आपके पास डायबिटीज के चलते आएंगे या आपको थायराइड दिखाने के लिए आएंगे, तो probably just 5 to 10% will be those patients who would come to you because of other endocrine disorders.
correct, but then if there's a patient who's coming to you with thyroid, do that patient also end up to you with diabetes or cholesterol in the long run?
हाँ, अब देखिए, वैसे टाइप 2 डायबिटीज जो कि मोस्ट कॉमनली हम देखते हैं, और उसके साथ अगर अंडर एक्टिव थायराइड या हाइपोथायराइड की बात हो, तो obviously the incidences and many of the studies would show that prevalence of hypothyroid state in those who are diabetic, type 2 diabetic, is slightly high.
Okay.
But there's no direct correlation
Okay.
between the two
Okay.
at large.
Okay.
So similarly, if you look at the other way, it's true the other way as well. But वैसे direct पे link नहीं है, unless it's type 1 diabetes, which is an autoimmune condition.
Okay, understood.
और उसमें क्या होता है, बॉडी क्या करता है, खुद के अगेंस्ट ऑटो एंटीबॉडीज बनाता है, तो वो कभी थायराइड के अगेंस्ट होता है, कभी वो पैनक्रियास में जो बीटा सेल्स है उसके अगेंस्ट होता है जी। तब हम देखते हैं कि उसको टाइप 1 डायबिटीज भी है, और साथ में आपका जो एंटीबॉडी मीडिएटेड थायराइडाइटिस
that is also developing,
वो भी साथ में रहता है, and then there is a direct correlation.
Okay, understood. So now only just focusing on thyroid. Usually people say thyroid ho gaya, they have made thyroid as a disease now. So just very briefly and like in a very simple term, what exactly is thyroid, and what are the main functions of it, and what are the thyroid disorders?
Yeah, so thyroid is basically a butterfly shaped gland which sits here at the neck, just below your Adam's apple. And if we're talking about thyroid disorders at large, it's of two types. One is the underactive thyroid, which we most commonly come across. The other one is overactive thyroid. So either the body is producing less of the thyroid, or your body is producing more of the hormone. So either of them can have various symptoms, and we need to address both of them. Okay, understood.
When does a person come to know ki now I need to get my thyroid levels checked? Like, are there classic symptoms of hypothyroidism or hyperthyroidism?
So in hypothyroid state, usually things start slowing down at large. So, your body's metabolism slows down, and then you might have hair fall issues, you might have a dry skin, you might have issues with the menses as well. But usually that's the only thing that increases. But rest all things slows down at large.
Understood. Yeah. Okay.
Yeah. And for the hyperthyroid, it's the other way around, because it's probably everything is accelerated, and so you might have a palpitation, you might have concerns like anxiety, agitation, so the nerves get affected as well. So those are the kind of, and might start losing weight because your metabolism goes up. So that's how the patient will come to you.
So now that we came to know about the symptoms, like these are like the classic symptoms of thyroid, but then what happens over here in India especially is that more than the symptoms part, it's a good thing also that people nowadays do these routine checkups, and then they come across कि thyroid hormone या thyroid levels बढ़ गए. So like if the patient is coming to you saying that my thyroid levels are increased, so what is the main thing that patient needs to check for?
देखिए, वही काफी बारी ऐसे होता है ना कि रूटीनली आप स्क्रीन करने के टाइम आपको दिखता है, एंड वो लैब क्या करता है, उसको बोल्ड कर देता है, और सब तभी हम बोलते हैं कि आप सारा जांच मत कराइए, बिकॉज उसमें क्या होगा, बहुत सारा ऐसे वो बोल्ड रहेगा जो कि जिसका कोई क्लिनिकल इम्प्लीकेशंस है नहीं. तो so many times TSH थोड़ा सा ज्यादा रहना जो होता है उसको हम सब क्लिनिकल हाइपोथायराइड बोलते हैं।
ओके
अगर आपका TSH का मात्रा 4.5 से लेकर 10 के बीच में हो तो उसको सब क्लिनिकल हाइपोथायराइड बोलते हैं, और it's a clinical call based on a lot of things as to whether to treat that or not.
ओके
So जब वो हमारे पास आते हैं, we ask them a few questions as to make us understand or to come to a decision as to whether to treat or not.
ओके
उसमें से एक जानकारी हमको जो चाहिए होता है वो कि आपका थायराइड का मात्रा कितना है, तो दैट इज फ्री T4, ठीक है। और थायराइड के अगेंस्ट कोई एंटीबॉडी बन रहा है कि नहीं, सो जो ऑटो एंटीबॉडी के बारे में हम चर्चा कर रहे थे इससे पहले, तो उसका मात्रा अगर ज्यादा हो दैट इज अनदर रीजन वी कैन ट्रीट हाइपोथायराइड स्टिल। थर्ड इज कोई सिम्टम्स है कि नहीं, जैसे आपका वजन बढ़ रहा है या आपका बाल झड़ रहा है या आपका कोई सुस्ती है, तो ये सारा जो सिम्टम्स है ये अगर रहता है तो फिर दैट्स अनदर सॉर्ट ऑफ इंडिकेशन टू ट्रीट। फोर्थली ऐसा है कि आपका जो खराब वाला कोलेस्ट्रॉल है वो LDL या नॉन HDL का मात्रा अगर बढ़ जाता है, then again that would be a clinical call to treat.
Okay.
If the person is a younger individual, then we should consider treating because the person has to live long, disease free. And अगर आपका थायराइड का मात्रा सही नहीं किया गया तो उससे आपका हार्ट का बीमारी जो है वो बढ़ सकता है, बिकॉज आपका कोलेस्ट्रॉल का मात्रा भी बढ़ जा रहा है। तो फाइनली एक और चीज होता है कि इफ द पर्सन इज अ फीमेल हु इज प्लानिंग टू कंसीव, in that scenario we have to push the TSH below 2.5, and we have very stringent goals during the first 12 weeks where the TSH has to stay below 2.5, and over the next 24 weeks it has to stay below 3. So these are the kind of scenarios where we actually take a clinical call as to treat or not to treat.
So why I asked this question, one of my auntie, she did this thyroid testing and she was Googling that my T3, T4 is normal, but my TSH has increased. So what to do about it?
Exactly. So that's exactly the scenario that we were talking about. This is called subclinical hypothyroid. And total T3 और total T4 जो पैनल में किया जाता है उससे काफी ज्यादा जानकारी हमको मिलता है अगर हम फ्री T4 करते हैं, बिकॉज सर्टन सिचुएशंस में आपका जो टोटल T3 और टोटल T4 है उसका मात्रा बढ़ सकता है, बिकॉज दे बाइंड टू प्रोटीन्स व्हिच आर कॉल्ड कैरियर्स, एंड अगर कोई परिस्थिति में उसका ये कैरियर्स का मात्रा बढ़ जाता है तो फिर आपका जो टोटल T3 और टोटल T4 है उसका मात्रा बढ़ जाएगा, जैसे ड्यूरिंग प्रेगनेंसी। तो दैट्स व्हाई वी इंसिस्ट दैट यू डू अ फ्री T4 done, which will give us a clearer picture.
So if any patient gets this report and जिसमें TSH बढ़ा है, it's mandatory for them to go and visit a doctor.
Yes, that's the first thing. That would be a very good starting point, I would say. For sure.
That is the only problem, because I feel that nowadays even thyroid has been taken very lightly. They know that they have to go to the medical guy, take the medicine and start taking the medication without even knowing proper dosages, without even knowing that do you need the medication or not at all.
Okay.
So how do you decide on this? Like if you take the history and then what are the treatment part of it?
So obviously we had talked about the symptoms at length, but there can be a family history as well of thyroid disorders, and we need to take a robust family history. Thirdly, what we want to do is, we want to assess the person as a whole. So many times क्या होता है, वो आपके पास आएगा, TSH का मात्रा थोड़ा सा बढ़ा हुआ है, and she might have gained or he might have gained about 20 kilos, and they would come back to you saying कि मेरा thyroid के चलते मेरा 20 किलो बढ़ गया. So that's the understanding that they have from, as we said, various medias where they'd be, harping on the fact that thyroid is the cause for weight gain. But in a sense, thyroid being elevated to that much would not account for such huge weight gain.
Yes, that's true.
It's the other way around.
Okay.
So just because you're gaining weight, that can adversely affect your thyroid levels. So the TSH can slightly go high. And if you actually lose weight, you'd see that the TSH falls back in place.
Okay, okay. So that means that the bad lifestyle is leading to
Yes.
thyroid. Obesity basically is leading to
Yeah.
thyroid.
So, I mean, there are things which can, give rise to multiple disorders. And one such thing is called insulin resistance. And insulin resistance मतलब कि आपके बॉडी में जो इंसुलिन बन रहा है वो ढंग से काम नहीं कर पा रहा है.
Yes.
अब ऐसा है कि जो इंडियंस होते हैं उन लोगों का हाथ पैर जो होता है वो दे आर वेरी थिन, बट यू पुट ऑन वेट अराउंड द वेस्ट.
Yes.
And that is called visceral fat or the abdominal fat, and that creates problem because वो इंसुलिन ढंग से काम नहीं कर पाता है फिर. एंड उसके चलते इंसुलिन रेजिस्टेंस जो होता है उससे आपका मोटापा हो सकता है, उससे आपका कोलेस्ट्रॉल इश्यूज हो सकता है. उसके चलते और मोटापा होने से क्या होता है, आपका थायराइड के ऊपर भी थोड़ा सा उसका असर पड़ेगा फिर. और साथ में डायबिटीज हो सकता है और जो हम ओवरऑल बोलते हैं मेटाबॉलिक सिंड्रोम. तो अगर हम वेट को एड्रेस करें तो ज्यादातर चीजों को हम फिर एड्रेस कर रहे हैं एक ही बारी. Similarly, if you're addressing the basic pathology, which is the insulin resistance, then we are taking care of multiple factors in one go.
Okay, okay. So if in this case also, if the patient comes to you, so what is the ideal treatment for treating the thyroid itself? Like if the thyroid levels are not balanced?
So as with any other person, you'd be talking about healthy lifestyle. You'd be talking about, the necessity to have a wholesome, diet, which is less of carbs and more of, proteins and good quality fibers. But there are certain goitrogenic agents which can be taken in moderate amounts. So that needs to be emphasized. There's no special diet that you need to recommend for anybody with underactive thyroid, but it's obviously helpful to avoid huge quantities of those goitrogenic food. And then thirdly, as we said, we need to take a clinical call as to whether we need to treat this patient or not.
Okay.
And if we feel that, treating this thyroid condition is going to give him a better or her a better quality of life, then obviously we'll be treating.
Okay. So it's not that कि every patient जो report में देख रहा है कि thyroid levels बढ़ गए will have to take the medicine. It's not that way.
It's not that way, and especially in the subclinical hypothyroid zone. But if TSH is more than 10, if it's a younger individual who is coming to you with symptoms, somebody who is planning to conceive, somebody with cholesterol issues where it can be addressed with thyroid, then definitely I think you have to treat that rather than sitting on it.
But then I have seen this lot of issue of taking thyroid medication regularly. I mean, I just saw a patient and the patient was like, I'm not taking my thyroid medication since 2-3 days. That's why I've started feeling palpitation. I asked, why are you not taking it? My stomach is upset. I don't feel like taking the medication, but I'm taking antibiotics. So I think I don't want to take too many medication. So they don't take this medication part seriously.
No, I totally understand, the pill burden part, and then, because it's a daily medication, people can forget. It might become challenging for, anyone to comply to a daily medication. However, what we try to say and make them understand is that, if there is a deficiency which is being supplemented, like your thyroid levels are low, that's why we're supplementing that. Just like you'd be wearing your specs.
Yeah.
You probably can do without your specs, but you'd see a lot better if you're wearing your specs.
That's true.
तो काफी बारी बोला जाता है कि इसको पूरे जिंदगी भर लेना पड़ेगा, इसको बंद कर सकते हैं फिर. तो वही बात है कि अगर आपका जैसे वो एंटीबॉडीज का मात्रा बढ़ा हुआ है, या आप you're a younger individual where treating the thyroid is going to give you additional benefits, then it's better to comply and continue with the medication. But कोई elderly इंसान जिसका हल्का सा TSH बढ़ा हुआ हो, that is because of change in the physiological set point. तो उसमें क्या होता है, TSH हल्का सा बढ़ता है as with advancing age, and many a times we see like thyroid medications being prescribed, or levothyroxine in particular being prescribed in non-dose or minimal doses, to an elderly individual. And when they come back to us, we usually stop that because 70 से ऊपर अगर आपका उम्र है और आपका जो रिप्लेसमेंट डोज है वो बहुत ही कम है, तो वी कैन, एंड आपका एंटीबॉडी का मात्रा नेगेटिव है, तो we can consider stopping the medication completely.
Right. So now also I have this thing in mind कि why people consider कि thyroid जो है वो later stage of life में ही हो सकता है और तभी हुआ तो भी ठीक है. Like if there is some young individual who's getting thyroid and then they make a issue out of it. Oh, at the young age when you have got thyroid. So why is this scenario this way?
So majority of the thyroid is because of the autoantibodies. Although underactive thyroid can happen after surgery or after using certain medications as well, but those are more of a rarity. But as we said, with advancing age, your physiological set point goes up for TSH. So that's quite normal. So not all TSH being slightly elevated needs to be treated right away. So it is completely individualized and customized.
Okay, so one important awareness message also I want, that what can happen if the thyroid goes untreated, or if the medication is not being taken regularly?
Yeah, so as we said, the thyroid medications, levothyroxine that we take, has got a long half-life. So unless you are missing it for almost a week or so, if you forget one day, you can start taking the next day as well. So it's not going to affect your thyroid levels, that much. But if you do keep forgetting at regular intervals, that's going to show up in your blood reports.
Yes.
More importantly, you will start getting back those symptoms that you started off with. So किसी को अगर lethargy था, किसी को अगर सुस्ती था, या आपको जो बाल झड़ना या गिरना और बाकी सारा जो symptoms we had described will get better eventually with thyroid replacement in adequate amounts. तो अगर वो अचानक से decide करते हैं कि मुझे ये नहीं लेना है, बंद कर देते हैं, तो फिर धीरे धीरे करके वो सारा symptoms वापस आने लगेगा.
Yes, true.
And so you have to set daily reminders, and there is a very specific way how to take the thyroid medication, and I'm just going to come to that. That it has to be taken empty stomach first thing in the morning.
Okay.
And then you have to have a gap of at least half an hour to 1 hour. And in that window period, you should not be eating or drinking anything, because that would actually interfere with the thyroid medication absorption. So,
yes.
So levothyroxine would not get absorbed if you're simultaneously taking certain food or the liquids that we are talking about. Also, some people routinely take supplements like calcium supplementations, iron supplementations. This can also interfere. Some antacids that we take, to lessen our acidity, that can also interfere with the absorption. So these has to be counseled. Like the patient has to be aware that you have to space them out, and you cannot take them within a very short window after taking the thyroid medication.
Understood. So just coming to the symptoms of thyroid, I feel that is different in men and women, right? Like women have this infertility problem, then they face PCOS issues या menses का जो problem होता है. So if they start this thyroid medication, this all can be reversible.
So polycystic ovary again is a genetic condition where there are two components. One, where the female has excess of male hormones in the body, which can show up as facial hair. For some, it can be excessive facial hair is what we're talking about. Menstrual irregularities at large, acne. So these are symptoms of excess androgens or male hormones in females. The other component is insulin resistance that we already talked about. So if there is a strong family history of diabetes and the person gains weight, then the insulin resistance becomes worse, and then they will start developing diabetes. Okay. Now, when it comes to thyroid at large, and you're talking about infertility, so polycystic ovary, the concern again is the excess of androgens that we had been talking about. In thyroid disorders, again, unless we have the correct amount of thyroid in the blood, that is going to interfere, or, because two things that we are concerned about. A, the pregnancy. The second one, of course, is, so we're talking about the maternal health, but more importantly, we are also talking about the fetus and its development as well. So that will be interfered. And unless you have the adequate amount of thyroid, that might, interfere with the brain development of the child. And because thyroid has its effect on the nerves as well, and the brain.
So with proper medication, lifestyle changes, I feel that thyroid can be properly managed.
Yes, absolutely. So, as the analogy that we had given you earlier, just like you wear your specs and you see clearly, and just like the power of your specs can go up, your thyroid requirement might go up, and you need to see your doctor at regular intervals. It can also vary slightly based on the weather as well. It is not your weather, I beg your pardon. I'm talking about, if it's summer versus winter, for that matter. So even seasonal variations can be there. And
so lastly, one important message that you would like to give to our viewers to help us spread awareness more on this thyroid disorders.
Yeah, so I think we should be talking more about, the thyroid, common thyroid conditions like the underactive thyroid, which we more commonly come across. And you'd be surprised that even the overactive thyroid is something that we come across as doctors very frequently as well. So both are equally concerning, and we need to address both. So the normal thyroid state is called the euthyroid state.
Okay.
So that's what we want to achieve. And both the person who has developed the thyroid condition along with the doctor forms a team, and they work towards, achieving the best possible thyroid levels that is indicated for them, pertaining on the age of the person, pertaining on the conditions as to whether they have, pregnancy or not in special case scenarios. So all of these are determined by the physicians.
Okay.
And both work as a team to achieve those numbers.
All right. So we'll just do a small segment which is true or false.
Okay.
And I'll give you a few questions. You have to tell me whether those are true or false. Okay. So very first question is, only women get thyroid problems?
This is not entirely true, because although the numbers are slightly increased in females, the males can also have similar disorders, whether we are talking underactive thyroid or overactive thyroid.
Okay. Thyroid disorders can be diagnosed with a blood test.
This is again partially true. Obviously, blood test is something that we resort to, but in addition to that, we might require some supplementary evidences in the form of imaging, special imaging, biopsy if required, etc.
Okay. Weight gain always means you have a thyroid issue.
It's not true. Whilst we know that, if you have an underactive thyroid, that might lead on to some amount of increase in the body weight. But, huge amount of weight gains may not be associated just with the minor elevation of TSH or underactive thyroid. There might be other issues along with that.
You don't need medication for thyroid problems.
So it is completely individualized, as we said. It depends on the age of the person. It depends on the symptoms that the person is having, and mostly depends on the clinical call, like the autoantibodies, and whether the patient is actually going to benefit from getting treated for the thyroid condition at large.
Okay. A swollen neck could be a sign of a thyroid issue.
So it can be. Swollen neck can be because of a lot of things, but underactive or a overactive thyroid both can give you a swollen neck, which is called a goiter.
Okay. So thyroid disease can run in the families.
It does run in the family, especially the hypothyroid. It runs in the family, so we do have a history of that.
Okay. Thyroid disease only affects older adults.
So it's again untrue. It's very commonly seen in younger individuals as well.
Okay. Fatigue is a common symptom of both hypo and hyperthyroidism.
So fatigue is generally, a term that we use, which is to me is a little vague, but it's more associated with hypothyroid state. The hyperthyroid state, on the other hand, might present with fidgety behaviors, anxiety.
So that's all. I mean, these are the questions that I have, and thanks
Okay.
a lot for being a sport.
Oh, thank you so much.
तो आज के एपिसोड से हमने ये जाना कि थायराइड एक ऐसी कंडीशन है जो टाइमली डायग्नोसिस विद राइट चॉइस ऑफ ट्रीटमेंट एंड विद लाइफस्टाइल मॉडिफिकेशन अच्छे से मैनेज की जा सकती है. So if you find our videos informative, don't forget to subscribe to our channel and follow us on Instagram at Mankind Specialities for more such valuable health discussions on various health topics. Until then, stay informed, stay healthy.